record button for us to start. I am going to actually turn my camera off because I'm going to be looking at a different angle. And so rather than having you look at my ear during the presentation, we will, I'll just turn my camera off so I don't look like I am ignoring you. And we will start here in just a second.
Morning, everybody.
Good morning. All right, we will go ahead and get started. First off, I'm visually sharing my screen with you right now to show you the monthly IFE meeting report. That is what is going to need to be filled out to show that you are in attendance. And just for some clarification, your project manager, those of you that are working in the office, you can just write which office you're working in and just put in there today's topic, which is COVID-19. And then you can send that off to the EHS email for registration that you are here today.
Amanda, this is Jim Bocci. Where can we find that form?
It is in the chat, and the very first thing I put it on there, it's located on the Corp site.
Okay, thank you.
In the EHS folder under the IFE. The next thing that I'm going to show you real quickly here is a copy of a little bit of what we're going to cover today, which is Oregon OSHA's COVID-19 temporary standard for all workplaces. This was new and came into effect in Oregon in November, the 16th of November. This poster I will be sending out later with a copy of our COVID-19 policy. But basically what I want you to understand is the aspects of this temporary policy that OSHA has put out for Oregon is integrated into our COVID-19 policy for our workplace. So all of the things that were expected from Oregon for us to do, we are currently doing and have in our policy. So this poster will be coming out to you later today when we send out the policy for everyone to review. The other poster that is going to be required to be on job sites that we are currently doing too is this one, just the reminder of physical distancing, the face covering, the workplace risk assessment, and notifying your employee when you're ill, in conjunction with our personal hygiene of washing our hands often. And then the wearing your face mask requirement poster. So those are the posters that will be coming out later when we share the COVID policy with everybody. But I just wanted to give you a quick look at those so that you knew what they were when they came to you. Now I'm going to minus this and we're going to go ahead and start the slideshow. So we want to thank everybody for joining us this morning. I'm here with Jolene, Chad, and Steve of our EHS 4x4 leadership team. And first off, we want to thank everyone again for all of your efforts to work safe this year. We have reduced incidents and have been able to meet our BHAG goal for 6 months so far out of this year, where we have worked with 0 recordable injuries. So that is phenomenal. And we are just really proud of the efforts that you're all making. And so great job, team. Today, we're going to be reviewing our COVID-19 policies for the workplace. This is our plan for reducing our employee exposure to COVID-19 through risk assessment and infection control plans using a hierarchy of controls. So what we're going to talk about, again, we're going to review what COVID-19 is, the symptoms for COVID-19, how it spreads, the steps that our company is taking to reduce the risk, our notification process to report exposure or illness, and our baseline guidelines for how we're handling our COVID cases. Steve's going to be talking about our steps for cleaning and disinfecting, as well as the PPE that we're using and how to ascertain getting supplies to your job site. Chad's going to be reviewing our daily COVID-19 PTP addendum, which is used to assess our daily risk for COVID and infection control plans that we're going to put into place. Jolene's going to be reviewing steps for working in high and very high risk areas. And then we're going to wrap up kind of with some questions and answers for you guys. So without further ado, here we go. This is our table of contents to our policy. So kind of a little bit of what I talked about there is covered in this in great detail. So it's a good read. And I'm sure you're gonna all enjoy it when it comes out later today. So basically, again, review a little bit the coronavirus, like we like to call it, the COVID now. It is a respiratory disease. It's spreading across the country. It's created a pandemic that we're currently in. So it's definitely affected every aspect of our lives and currently doesn't show any signs of stopping. Hopefully they, will get the vaccine out there and we'll be able to slow this process and get it under control. But right now we're still in this pandemic together. So in reviewing the symptoms, without looking at my PowerPoint that's shared there for you, who is the first person that can give me 5 signs, symptoms of COVID? You can write it in the chat box. Jolene is going to tell me when we have the first person that's entering something in the chat box.
So we have Emily. Oh, lots of them coming through. So Emily, loss of taste. Nolan, fever. Brad, fever. Sheila, fever. Mark, fever. Chad, loss of taste and smell. Runny nose.
Yep.
A lot of coming through. Body aches, cough, difficulty breathing, muscle aches, temperature, sore throat. So
they're coming in. Those are the signs. You guys have seen our little poster. I will click over to it. Fever, chills, cough, shortness of breath, fatigue, all of those muscle body aches. You've seen this in our stop, don't come to work if you have any of these signs and symptoms. Yes, those are the signs of COVID. Remember, you can also be asymptomatic. So you may not show any signs and still have COVID. Of course, this is part of the problem that we have with COVID right now, is that we have people that could be walking around with COVID and they don't know that they have COVID. And then one of the other special components of COVID-19 is that once we've been exposed to it, a person that has COVID, it can take 2 to 14 days for us to develop the virus. So we could be walking around after an exposure to somebody that's asymptomatic and we don't know we have COVID, and then we are walking around with it. Maybe 7 days later, we start developing symptoms. We don't know where we got COVID, but now we have symptoms and now we're subject to staying home until we figure out whether we are COVID positive or COVID negative. So there's a lot of moving parts to COVID-19 that have kept me quite busy over the last several months, and even more busy in the last month and a half. So can anybody tell me how COVID-19 spreads? Go ahead and utilize your chat.
close contact, physical contact, respiratory droplets, physical contact, person to person, airborne through the air, touch, close contact, surface contact, being within 6 feet of someone.
Right, being within 6 feet of someone, that's something that's in there. So touching a surface with COVID isn't necessarily going to give you COVID, but what happens if I touch that surface that has COVID on it and now I touch my eye or I put my finger in my mouth, which hopefully we're not walking around the job site putting our gloves on COVID and then putting our gloves in our mouth, but those are ways COVID is going to be passed on to others. So things that obviously we can continue to do to reduce that risk is maintain our 6-foot social distancing at all times. If we're going to touch a surface that somebody else may have touched, washing our hands before we touch our face. our mouth, nose, or eyes, so that we don't pass that on to each other. So good hygiene is really, really important to reduce the risk of that, and maintaining our social distancing. Those are all things that we can do in addition to wearing our masks, which is mandated now that we are wearing our masks. Those can reduce us from sharing germs to other people. So those three things in itself are really going to be helping us reduce the spread. And just in looking at our case review and how things are, we are not spreading it to each other. So we are not passing it on to each other. We have been able to, all of the cases that we've had offsite exposure, whether it's a positive case or a tier 1 case, we're not passing it to the next level. So good job, everybody, for wearing your masks, for not putting your hands in your mouth, on touching your eyes, your face, or your nose. All of those things are working for us. And if we can continue to move down that path, we will stay in the numbers that we are right now. Yes, we're doing a lot of testing for employees. We're asking them to test so that we know if they have positive cases, but the majority of those tests are coming back negative. So that is good. That means we're doing our job, and very proud of all of you for doing that. Go on to the next slide. Okay, we talked about that. As you may know, you've seen this sign, hopefully. You're familiar with our policy, but right now our current policy, if we have an illness and how we're preventing the spread, is if you are sick with any of these symptoms, you are asked to stay home. And I know that is hard, and but we tried to make this as simple as possible. And so rather than having me, who is not a healthcare provider, try to decide which symptoms are the ones that are going to stay home and which symptoms are the ones that are going to go to work, it's just flat across the board. If you're exhibiting symptoms and they're on this COVID list, we're asking you to stay home for 10 days. One, so that you're not spreading any germs. Could be the flu, could be a cold. We don't really want you to be spreading that either. But if it is perhaps COVID, we're hoping to reduce that spread as a company. There are means to return back to work earlier than that. We have one exception to that, and that is if you want to get a negative COVID test and it comes back negative, and you have a doctor's note that is saying your symptoms are not related to COVID, then you could return before those 10 days. But that's just our policy. I understand it's difficult, but it's pretty cut and dry. And the less gray area we have in it, the less chance we're going to have of being confused. So just understand what that is. The next part is looking at our basic COVID guidelines. And so when I say basic, I mean basic, because each case is different and each case requires a little bit of thought process and understanding the CDC expectations, the EC expectations, and how we put those into play. So the plus sign is signifying positive cases or presumed positive cases. So that can be a positive case with an employee. It can be a positive case with a friend or family member, someone that you've been in contact, but there's a positive case involved in the process. So if you test positive or you're presumed positive based on your symptoms, or the fact that you've been exposed to somebody that's positive, so there's a more likely chance that the symptoms that you're exhibiting are going to be positive. We have a isolate policy. Call your supervisor, stay home. Don't come to the job site and tell me that you think you're positive or that you're positive. Stay home, reach out to your supervisor. They're going to put you in touch with our COVID case management team. And our policy is for 20 days, we're going to have you quarantine. I know everybody is now in a panic. 20 days, I'm going to be off of work. I am going to work with you during those 20 days to see if there's an opportunity for you to return earlier, especially those that have been asymptomatic, which means you didn't have any symptoms. So there are possibilities of returning to work before the 20 days, and we will review that with you while you are in quarantine and isolation. Let's see. The next part of that. So if you have questions on that, we'll reserve those till the end and come back to that. But just know that there are some possibilities of getting back to work sooner than the 20 days. If that works out with your healthcare provider and we can get that information, then we can work on getting you back sooner. The very minimum that you will be off is 10 days for sure. When we look at tier 1, which I'll explain that tier 1 is the person that has had direct contact. So they've been identified as a close contact to somebody that is working with or has worked around or been around either a family member or a friend that has tested positive. So direct contact with a positive person. Who can tell me in the chat what I define close contacts, what the CDC defines close contact with EC? What is that definition for close contact? And Chris Ernst, you're not allowed to send me an email link to the CDC.
So within 6 feet for 15 minutes.
Is that 15 minutes just one time? How does it work?
For an accumulative 15 minutes, 24-hour period of time.
Yes. So 6 feet, working at 6 feet for or less for 15 minutes or more. It's 15 minutes at one time or 15 minutes of cumulative time. So that conversation that you're having when you're reviewing the plans. So the plans are on the desk, the supervisor's there, you're 6 feet away from them, they're reviewing it, going through it with you. If we're doing that 3 times for 5 minutes, we have reached our 15 minutes. So we really have to be, this is new, this has only been in effect for, don't quote me, but the last month and a half, it's been pretty big focus. So I understand that that might be new to some of you, but that is going to be a little bit harder, especially when we're in a supervisory role, when we're checking on employees and things like that during the day. Keeping that contact to less than 15 minutes is going to be a real focus. If you can't keep it to less than 15 minutes, then you're going to need to spread your distance out further. So outside of 6 feet, maybe it's a phone call, you're talking on the phone instead of having that contact directly with that person. We're going to have to think outside of the box in order to reduce the number of people that we are identifying as a close contact. So if you've been identified as a tier 1 contact, basically what's going to happen is that you are going to be asked to quarantine at home. There are gray areas in this. And what I mean by gray areas is it's not cut and dry that 14 days is going to be all that you're off. So what I mean by that is it all depends on how your ability to remove yourself from the positive person. So it's all based on when your last date of exposure to that person was. So let me give you an example. If I here in my home have somebody that's tested positive for COVID, and let's say it's my 2-year-old grandson, there's no way that I'm going to be able to isolate away from that. He's going to be able to isolate by himself. He's 2 years old. So I will have continued exposure to him because he's part of my household. He has to be cared for and taken care of. So what happens in that scenario is that because I can't stop being around him, I can't stop being exposed, for the 10 days that he's considered contagious, I don't get to start my quarantine. My quarantine has to wait until the end of the 10 days that he's contagious, and then I will start my 14-day quarantine. So it's all dependent upon the last time that you're going to be around that person that's got positive for COVID and whether or not you're able to isolate from them. So we go through that all when we're talking to them. And we also go through the process of determining if they had any close contacts, because part of EC's policy is identifying our tier 2 exposures. And for EC company, our tier 2 exposures are the individuals that have had close contact with our tier 1 individuals. So I'll go back to an example we were talking about earlier. We have the journeyman that's at the desk. He's reviewing the plans with maybe an apprentice that's 6.5 feet, 7 feet away. So they are at 6 feet. They're discussing this process. They are at that 6 feet distance or less for 15 minutes or more. What's happened is that my journeyman that was at the table, his wife has now tested positive for COVID. So my journeyman goes home. I have a conversation with the journeyman. I find out who he had close contacts. He names his apprentice because the apprentice was there within that 6 feet for 15 minutes or more. I asked my journeyman at home to have a COVID test, and I asked my apprentice to wait at home until I get that result back. Because if my journeyman also tests positive, my apprentice is now moved from the tier 2 category into a tier 1 category. So we go through that whole process when we're dealing with this, and we're looking at each case. If my journeyman test is negative, my apprentice is now allowed to return back to work. We do work with them to ensure, if I've asked them to stay home for that time frame, we work with the COVID Relief Fund to get those hours for that pending test reimbursed so that they are covered while they're off. Offsite exposures to COVID, those are all situations in which you're able to file for unemployment. You can use any of your sick leave or your sick time off if you want to use that to cover that. If you make less than, I believe in Oregon, if it's less than $120,000 combined income for the year, you're able to apply for the COVID Relief State Leave Fund, which allows you to get $120 a day for up to 10 days. So there are things available. And as Andrew has shared with us many times, the COVID Relief Fund is available for assistance if you find yourself in a really hard position and you're going to need some assistance. Those get submitted and approved. So we do have assistance available, but those are the basic guidelines of what happens when we're dealing with a case. And hopefully I haven't confused everybody. I'm looking at Ron for confirmation whether he's confused now more or not. He's shaking his head. So, but I did want to review that because I know it's confusing, and I know that just understand that when we identify somebody in one of these categories, I go through this whole process of understanding their exposure, understanding their close contacts with them, and making sure that they have an understanding of what that process is going to be. It may not all be clear to you as a supervisor, but know that we've worked through it and we understand it. And so the end result that I'm giving you, we didn't get there just by chance. We went through a process of that identification in order to get there.
Hey, Amanda.
Yes.
So there have been a few questions in the chat. So I just wanted to point out, we're trying to respond to those as we go along to everybody. There was a question in regards to testing too soon, where you may come up with a negative and then later on develop into a positive case.
So yes, we are trying not to have anybody that is identified as a tier 1 test before 72 hours from their last exposure, so that we get an opportunity to hopefully have them in that time frame when they could have COVID. Our tier 2 level is a little different than the CDC's. We're a little bit more precautious. When you go through the CDC tier levels, they're all in relation to the positive person. So our tier 2 cases aren't really in relation to the positive person. They're in relation to the tier 1 person. So it's an extra precaution that we're taking as a company. And just again, an FYI, we have had no one that has tested from a tier 1 in a positive scenario that has passed that on to a tier 2. So everything that we're doing now for the protection of our company has benefited us and is paying off. I understand there were some questions on CDC guidelines that were released today. Obviously, this is an ever-changing policy, and we update it as soon as we have new information. And so it's what we call a live document and gets updated as necessary.
I think
But
the only
the-
other one was with
the
close
policy-
contact.
Go ahead, Jolene, sorry.
The only other question was just in regards to close contact. So when you're within 6 feet of somebody, CDC deems that contact with or without a mask. So, I mean, we're all wearing masks as a precaution, but it's pretty much a moot point. If you're within that 6-foot barrier between people, it's a contact. So.
Yes, so you will be identified as a close contact, but keep in mind that you've done extra protections to protect yourself from that resulting in an exposure. So even though you may be asked to quarantine or you may be asked to be off pending test results, understand that we've added extra precautions to that to protect you so that hopefully those continue to be negative results that we get. Ron?
I was just going to reiterate what you said earlier. The CDC guidelines and things are minimums. Sometimes we have a more restrictive policy, but based on our results for the last 9 months, it works, right? I mean, we're not, as you said, we're not giving it to ourselves. So it may seem restrictive, but it's proving out to be the right policies and the right precautions. So
Any other questions on just our basic guidelines and understanding? And if you think of a question that you want to ask me about it later, feel free to email. I'm happy to have that communication with you guys at any time to help you understand that process. Okay, so just a couple of things to hit on. We do have the crisis management team, again, that is reviewing all of the information that comes out from the CDC, all of the information that's coming out from OSHA, from our state OSHA plans, from the state agencies, the healthcare, World Health, Oregon Health, Washington Health, all of those departments that maintain the standards that are being set. We review those things and make sure that they are implemented into our policies. Everything that we can do to work through the pandemic, we're doing together. Obviously, as I reiterated in the prevention plan, the biggest things that we can do are maintaining outside of our 6 feet social distancing, wearing our masks 100% of the time to reduce that risk, not touching our face, practicing good hygiene, all of those things, including what Steve's going to hit on, which is the cleaning and disinfecting and keeping things clean. All of those things are helping us reduce any COVID exposures that we're having in the workplace. When we talk about controls that we're implementing for reducing our exposure, controlling infection control plans, risk assessment, we always are talking, starting with a hierarchy of controls. So what are the things that we can do? Our first level of hierarchy of controls is going to be looking at engineering controls. So what are things that we can engineer out of the equation? So Oregon's new definition to a personal space now has walls and a door. So that makes it a little different for you to remove your mask if you don't have a wall or a door. So what are things that we could possibly engineer out for that? Obviously, the shower curtain scenario isn't really fitting into the door scenario, but we're actively reviewing what options we have out there that could be temporary walls with doors, could facilitate working in that. Because the only time right now that we're allowed to not have our mask on is obviously if we're in our own office and the door is closed. If we're in a break room and having lunch, so actively eating. What we need to be mindful of in those scenarios is when we're not eating or drinking in the break room, we still need to put our mask on, okay? Because those are our most susceptible areas to spreading COVID right now is our lunchroom and our break room, because those are the times when we have our masks off, right? So even though you can have it off when you're eating or drinking, having it off your whole lunchtime when you're in the break room isn't the best plan. So it's when you're eating or drinking, not just during the break time itself. So obviously there's other things we can do. We have rotated breaks, added more lunches to our shifts so that there's minimal people in the job site trailers. If you are a supervisor and you're managing a job site trailer and you've been to the Portland office, I want you to visualize the education center. So visualize the education center and how big it is. Inside the education center right now, we can have 10 people spread out. Okay, now think about that in comparison to your job site trailer where you have lunch and break for your employees. Are you meeting the capacity limitations correctly for how many people can be in your trailer at a time? If not, reach out to EHS, reach out to somebody. We may need to make some changes. Those are our biggest areas of exposure, and having additional trailers if we need them. You can only do so many shifts of breaks and lunches to rotate your crews if they're in a larger capacity. So, it's not possible for us to start having break right after we get to work at 7:30. So additional trailers, anything we can do outside to set up covered areas. You can encourage people if they want to eat in their vehicles. I know that's not, that's not what the requirement says. We do have to provide them with a place to eat and break, but obviously the least amount of people that are sharing those combined spaces are going to help us reduce the risk of spread. So think about that. Those are engineering controls that we can do. If you've been to some of the offices, you may have seen plastic barriers that have been installed. Those things help reduce the risk of passing on COVID. Limiting the number of people in our office is a control that we've done. So if they can work from home, then they need to be working at home. We are following that policy across the board. Establishing directional path flows. Those are engineering controls that can be put into place. So one way into the job site, one way out of the job site, controlling that span of how many times we have to walk past each other in a hallway. Those incidental exposures are not considered part of your 15 minutes, but anything we can do to reduce that risk is going to help us. So then we look at administrative controls. So administrative controls, we've put into place the policy, if you're sick, stay home, right? Minimizing our time with clients face-to-face, reducing our offsite lunch times, encouraging our employees to maybe not carpool, because those are times when we're susceptible. Think about where you're doing off time. Those are things we can make suggestions about, but we can't implement. So we do ask our employees to think about those, but establishing alternate shifts. So rotating shifts if the job site will let you, when there's less people on site. So instead of everybody working the day shift, bring in the crews at different times if that's can be happening. I know one job site I heard that they were doing shifts of who was there. So one group would come in and work, and then when they got done with their part, the next crew would come into work. So whether it was the plumbers and pipe fitters and then the electrical, and hopefully that flow was working well with everything getting coordinated and put together in that process. But whatever you can do to reduce the number of people that are going to be exposed at one time is going to help. Working on our travel restrictions. So we, as far as traveling to other states, eliminating the need to have that be part of the process right now. Only traveling for essential needs and essential times. Using our PTP addendum, that is administrative control that we put in place. Maintaining the 6-foot social distancing. Establishing communications. So we have communications coming out from a CMT. We have communications coming out with updates during our safety meetings. We have information coming out during our IFE meeting. And then we move on to kind of work practices. So having hygiene product available for you to utilize, making sure regular hand washing, disinfecting the tools, which Steve is going to go into now, And then I'm just going to quickly show you some of the forms that we have available. So our employee tracking forms, so somebody that is maybe on furlough, we've utilized this form for furlough. People that are out on quarantine, this can be filled out for them if they have to turn something into the hall in order to get their leave pay or those kind of things. This can be utilized for that. This letter is, I'm going to start sending this out if people are home sick with symptoms, just explaining our policy. So they have something in writing to visually look at. I think that will help with the process. So kind of identifies, you know, you're out with symptoms. These 3 things have to be met. The only exception to that would be, of course, getting the doctor's note and the negative COVID test. And then I gave them a little bit more information kind of about a definition of a tier 1 and a tier 2 if they have that type of exposure. So that's going to be coming out. Sorry, this has got off kilter when I changed it to PowerPoint. The guide for returning to work. So those people that have been off-site for a lengthy period of time, we do need to review with them our COVID policies as soon as they're back on site to make sure that they understand the expectations. They're wearing their masks, they're wearing their mask properly. All of those things need to be reviewed. So there is a sign-off sheet for that to be completed and turned back in. So because we are tracking that and we are responsible for tracking that. The health screenings that we're doing, temperature taking in the offices, on the job sites, making sure that people understand that they need to pass the health screening before reporting to work. So if any of these answered yes, of course, we want them to stay home, call their supervisor. EHS will reach out to them. The COVID team will reach out to them and ensure that they, whether or not they can return to work, whether or not they need to be out for the 10 days, whether or not they possibly have been exposed to somebody that has COVID and what that next process is going to look like. But if these questions are flagging you and you have concerns about them, don't go to work, call your supervisor, get in touch with the COVID team, and we'll work through that process with you. This is kind of the explanation of that policy, what it looks like for temp taking. And now I'm going to turn it over to Steve. He's going to talk to you about cleaning and disinfecting tools.
Okay, good morning, everybody. So can everybody hear me okay? Okay, hopefully I don't lose you. I just, being that we're working at home at times, I had a cable guy just show up at my door, so hopefully it doesn't go and disconnect me. So cleaning and disinfecting tools, you know, one of the things that we get to all the time on the job sites is making sure that we're maintaining that, not sharing tools. So on the job sites, we want to make sure that we are not sharing tools, that we're taking the time to clean our tools after we're done using them. If we do have shared tools, that we're taking the time, wiping them down, sanitizing them. We should have plenty of sanitizer out there on the job sites. If you don't, make sure that you're requesting the sanitizer. The sanitizer that we need to be using, there is on the EPA.gov table 4, list 4. It gives you the sanitizers that are approved that are actually going to kill COVID. And it'll go through and it'll give you a list of them. The thing that we need to be careful of is we need to understand that when we're applying these, we need to read the directions. So if you're using a Clorox wipe, it should be left on wet. We don't want to be taking and wiping it down and drying it right afterwards. We want to let it dry naturally if we can. One of the issues that we have with that is that we're wiping it down and we're not killing it off. It's going to take time to do it depending on the product. So read the product guide that you have. The sanitizers that we have, you want to make sure you're spraying those on and leaving them on for at a minimum of 10 seconds, but allow them to dry as best if we can. So if we can spray down our tools out there on the job sites, that's one of the things that's going to help us. If we are having to use bleach out there, bleach is available now. A lot of the sanitizers are available throughout. We don't really have shortage issues as we have had in the past, but if you do need to use bleach, it's a 5 tablespoons bleach per gallon of water. Going through for disinfecting tools I'm sorry, not tools, but equipment. So in the offices, again, the same as the field, no shared tools. Don't be sharing your keyboard, your computers. utensils and that. As far as your pens, your pencils, making sure that you're keeping them to yourselves. When we're signing off on documentation, just have one person sign a document and fill everybody's name into it, and then turn them in that way. It's the safest method to go through. So on the equipment itself, printers, coffee machines, water dispensers, sinks, things like that we're going to be using in the wipe it down beforehand to use it, just to protect yourself from anybody else that was there before, and then also go through and wipe it down for the next person when you're completed with it. The other thing we want to make sure that we're doing is going through and having somebody in the offices, if we have enough people there in the office, that one individual is designated preferred, that they're doing a wipe down on all those hotspots, those community areas, the doors, towards the bathroom, the entry doors. The other thing that we can do to help eliminate is to not use as many doors. Try to come in and out of the same doors all the time. That's going to help to eliminate, some of the spread of things, getting to different areas that don't get maintained. So if we can have somebody else go through and do that. For construction trailers, job trailers, we need to go through the same process, making sure that at the end of the day, we're doing a wipe down. Somebody should be going through wiping down all of the common areas that are there for the break areas, the tables, anything that is a shared area. So if you have your office in a trailer, try to keep it to yourself and don't let anybody else use that area in that space. Back onto tools a little bit, disinfecting your tools, you want to make sure that we are wiping them down, as I said. Wearing nitrile gloves, if you're sensitive to it, make sure that you have the proper PPE on when you're wiping those down. So wearing nitrile gloves or your regular work gloves. But if you are sensitive, make sure you do get some nitrile gloves and some face protection as needed for it. As far as tools go, on the harnesses out in the field, I can't use chemicals on those. So just make sure that we're leaving them out to hang dry for the 72 hours. Go ahead and go next slide, Amanda. So gloves, if we're wearing gloves out there in the field, remember that it's a biohazard, basically. There's a potential that somebody, you could have captured something off of, a countertop, a handrail, or a door handle, something like that. So if you are wearing gloves, and that the proper disposal of gloves is making sure that we are grabbing the glove from the palm level, pulling it out, pulling it down inside out, as the picture shows here. Cup that glove that you've taken off into the opposite hand, and then put 2 fingers on the inside and peel it off and turn it inside out and collect the whole thing, and then dispose of it correctly. So these aren't necessarily biohazard with blood onto them, but we still want to make sure that we're disposing of them correctly. So don't be throwing them around, just eliminate them and put them into the garbage. So personal PPE, as we get out there into the field, there's different areas that we're going to be working in, different levels that we need to be able to protect ourselves. So there are some areas that you may need to have a Tyvek suit, gloves, goggles, face shields, or different cloth face masks, respiratory protection when it's appropriate. I know that in several areas we've designated individuals, had them tested, and they've got their clearance and certified to go through and work in some of the hotspots that we may be working in. So they've had their respirator fitting and their medical cards with that. So we do have individuals there. Making sure that the PPE that we have is the correct PPE for the task. Chad will be going through that in a minute, or Jolene will be going through that shortly. Making sure that the PPE is disposed of correctly. That's another thing to make sure that we're not just taking it off and throwing it out there and leaving it in the truck and that. So making sure that we're disposing of it correctly. When it comes to PPE, you have to remember as well, your mask is PPE, the mask that you wear every day. Everybody has been supplied, or should have been supplied, at least 3 of them. I think most of us have 3 to 5 of them now. We have different styles of masks. We have a lot that's out there. If you have the paper style mask, the older KN95 or that, or the blue medicals, those are only a one-time use. You want to use those for your day or a half day and then throw them away and replace them. You want to make sure that your regular masks, that you are washing them on a regular basis. That it should be a daily swapping them out. That's why we got 3 for everybody, so they would have them and you have an opportunity to wash them and rotate them around. But again, the best practice is soap and water. To be cleaning your clothes, soap and water, it's going to eliminate it. And washing your hands, 20 seconds washing your hands, just going through those steps and making sure that we're protecting ourselves. You have to protect yourself first, and then you can work towards protecting others. So on the other half of this is going through with your 6 foot distancing, making sure that if you're around anybody that that they've been possibly sick in those areas, that we are shutting the area down and we're taking the time to sanitize it. So that's one of the things we need to make sure that we're doing. If we know that we've been within 6 feet of somebody, or if we know that somebody's been on a job site and they've been sick the previous day and they've gone home sick, we want to make sure that we know where they've been and that we take the time to sanitize and to clean all the areas that they've been working in and do a thorough cleaning of the job site and the trailers or the lay down areas that they might have been working in. On the EEW clothing, everybody knows now that we've changed over on our EEW clothing because of COVID. So we've gone through and we've eliminated the need for sharing clothing. So everybody should have their old clothing. Sounds like my kids are starting up, Ron. So give me 1 second here. Excuse me.
So I'll take over on that. Yes, we have changed. We have our clothing that's going to be rotated regularly with Cintas. It's being laundered and returned. Everybody is not at this time anymore sharing PPE for EEW. If for some reason your job site is asking you to share that type of PPE, please reach out to E and we'll get that rectified, because there is no longer there should be no sharing of EEW equipment.
Right.
Okay, and cloth face coverings. So the CDC has guidelines for what is a proper face covering. So I want to make sure that if we are making our own face coverings, that we're following the CDC guidelines. We had some changes a couple of months ago with bandanas and the gaiters, making sure that they are a double layer. If you were to use a bandana, it's making sure that it's used properly. A bandana is not to be used as a gaiter and just folded in half and tied around your head. It needs to actually be fastened in the way that the CDC guidelines give to do that. So on the fittings, so if you have an EC mask, you'll notice that most all the masks that we have out there, they have a little piece of metal over the top of the nose on the bridge, and that's to close it up to try to get a better fit for it. So making sure that you have a quality fit on your mask. And that's one of the other things about a mask is washing it and cleaning it. It keeps it from stretching out as much, and it keeps it maintained. So it's not going to be getting loose on your face. So it does allow it to shrink up a little bit as well. So, but again, making sure that we are using the masks and that we are have a proper fitment on them, and that we are sanitizing, cleaning our masks on a daily basis, or replacing the paper masks. And our COVID-19 supply request form. So that's a form that we have out there that if you need PPE, we can get you the PPE that you need. If you require N95s, Tyvek suits, if you're going into a high-risk area, you're going to want to fill out this form. and make sure that you get the equipment that you need. If you just need to get disinfectant for countertops or for hand sanitizer, if you need additional face shields, additional masks, if there's anything that you need that's COVID related, make sure that you're filling out this form so we can continue tracking it. Purchasing goes through and they review all the stuff where we're at, as well as the tool guys. So I want to make sure that we're getting that information and we're tracking it. So please fill out the document when you do request the COVID supplies.
Thanks, Amanda. Good morning, friends. So as you know, CDC has recommended or has classified 4 different risk exposures. We have the very high risk exposure. Those are medical personnel, mortuaries, high risk known areas of COVID-19 and exposure, nursing homes, long care facilities, hospice, some hospitals. We generally fall into the medium class exposure area, and the lower risk class of exposure. Lower risk right now has basically been defined as working alone, right? So like everything that we do, you can switch it, Amanda. Like everything that we do, if we have a known hazard, we plan to mitigate it. And the new Oregon temporary rules has to have a risk assessment for infectious control. And we've already implemented this, so this isn't new to everybody. But the expectation for our office staff, if and when we are allowed back into the office, that each one of us are going to have a PTP addendum filled out for our general day use, right? This is an example of what this looks like. This is happening every day in addition to our PTP planning of our work. And it specifically addresses our mitigation steps of how we're going to limit the exposure to COVID and the spread of this infectious disease. So it's, so once you get back to the office and you're in the office, each one of you are going to have to fill this out, and it's you're going to have to answer these questions. So how are you minimizing the people in one area and limiting groups to fewer 10 or more? So how would you do that? Well, I temperature screen, I answer my health questions, I wear my mask when I enter the facility, I go into my office, and I keep the door shut. You may answer it that way. So how do you plan to keep your tools and your tools safe and sanitized? That could be your keyboard, that could be common areas at the, in the break room, at the drinking fountain. Well, the expectation is that I know that we have cleaning and sanitation products set up at the copiers, in the shared areas, and at personal desks, right? We're wiping down things before and after we touch and use them. So how are you going to maintain 6-foot distance during work and social activities? What is the plan if you need to work within 6 foot with one another? The expectation is that we don't, especially in the office, right? We can do our jobs. We've got we've all have Zoom meetings, we've got phones, we've got Teams meetings. If you are separated into an office, right, you can have a conversation at the door. Just take a look at how you interact with people on your team and in the facility, and make sure you have a plan to make sure you stay within out of 6 foot with one another. If for some reason that you do need to have 6 feet, be within 6 foot, right? The expectation is that you would wear your face cover and a face shield, just like we would in the field. That is our policy, and it's something new that you may have to get used to in the office when we open up. Are there any other items that need to be addressed to maintain safe distance? Engineering, administrative controls, ventilation, physical barriers, all things Amanda's talked about. Job site trailers, we've delineated desk space with plexiglass and shower curtains. We've got one-way stairwells up and down. We're looking at the ventilation systems and replacing those filters with HEPA filters to ensure that we're capturing anything that we can, updating those systems as well. And just daily reminders, right? Amanda's talked about it at length, right? If we have any of these symptoms, We know that a temperature, a fever, sore throat, cough, difficulty breathing, all signs and symptoms. And we do not come to work and tell anybody, right? We call in, we get EHS to address those symptoms and get a plan to either get you quarantine tested and make sure that you're safe and symptom free before you come back to work. Personal hygiene, don't want to belabor it too much, right? But we're washing our hands, we're wiping down things that we're touching. We're trying to keep our hands out of our face, eyes, nose, and mouth. Job site and office requirements, still maintain 6 foot between us and anybody that we come in contact with. You know, encouraging our clients, vendors, and everybody to not stop by the office, but do more of the electronic communication that we've all have grown accustomed to, Zoom, Teams, phone. We have to wear a cloth face mask anytime we're out in a common area in and around everybody. The only exception would be if you're in your office, separated by 6 foot between you and your colleagues. We're still doing the health screening and the temp screening, health screening and temp testing every morning. I know UTVs and ATVs, we've barricaded each passenger seat with a physical barrier, almost like a sneeze guard, to keep that separated. If there are times where we have to be in a personal or a company vehicle, the passengers to wear a motorcycle helmet. That is a real policy. And I know it sounds ridiculous, but with airbags traveling at high rates of speed, the only way to be protected is to have a motorcycle helmet, full face motorcycle helmet, and everybody wearing a face mask at that time. Those are the exceptions. That is not the, I mean, we're trying to limit carpooling altogether, right? I mean, 6 foot, you can't maintain 6 foot distance in a passenger vehicle unless we're driving a van and there's no room to sit in the back of a van. So let's not go down that road. But we have to have 2 people in the vehicle. A motorcycle helmet is required per our policy. Again, you have symptoms, stay home. We're cleaning and disinfecting. We have plenty of EC supplied sanitizer and disinfectant for our common areas. There should be plenty of spray bottles. If you see them getting low, use the COVID supply form and get those turned in so we can get them filled and out for your use. Next slide. So as I talked about, medium risk exposure is the definitions of what these are, right? So medium risk exposure include those that require frequent and or close contact with people within 6 foot that who or may be infected or suspected to be infected with COVID. This includes areas with ongoing community transmission. Employees in this risk group may have frequent contact with travelers who may return from international locations. So just that first sentence there, we're in a community of ongoing transmission. Washington and Oregon, our numbers are rising. You can see it on the news. We're medium class. I know we're taking precautions. We're not coming to work when we're sick. We're wearing our masks. We're cleaning and disinfecting. I think that's, even though we're having all those measures, the community transmission is still high, and we can only control what people do during their, during the day while they're at the project. So who knows what's happening when they leave the project, who they come in contact with, what their protocols have been and what they've adhered to when they haven't been around you. So we consider ourselves medium class, medium risk class. And that's a requirement that, we're doing the temp screening, we're doing the sanitation, we're wearing our masks 100% of the time, we're maintaining our 6 foot separation, knowing, and we've installed engineering controls and administrative controls throughout our project. And as you know, they've been laborious to enforce and get set up, but those things are implemented, and we're following them per our plan. Maintaining 6 foot, we're doing a risk assessment every day with our PTP addendum. We're looking at the work we're doing and making sure we have all of the PPE and work processes outlined and coordinated with other trades. That includes trade stacking. We have scheduled, at least on the projects, trade stacking. We're trying to get areas that are hours and hours alone so we can perform our work. That way people aren't coming into our work area. We need to utilize meeting requests for conference rooms, right? Making sure we're not walking in other people's conference rooms while they're having, if those conference rooms are being utilized. That's where we're at with medium risk, right? Our PPE is available. We've got nitrile gloves available. We've got all this cleaning and sanitation, and making sure we're filling out our PTP addendum on a daily basis for the field and establishing one for the office. Like all of this stuff, the PTP addendum, we need to keep and retain these documents, because that's an audible and measurable item that is going to be needed if and when Washington or OSHA want to come in and audit our program, right? We're not, this is something that has to be done for our office and our field. So once they get established, please make a copy, send them to EHS so we can have them on file. The expectation for the projects are that these things are being done every day, which I know that they are because I've seen them, and they're scanned and stored into the job file, right? And that way, if somebody were to come and ask us for them, we can show that we are following the temporary rule. This is something that we've been doing for the last 9 months. Here's the documentation and the proof that we are taking this serious and doing a risk assessment daily for all of our activities, office and field included. Next slide, Amanda.
Can you just touch on what their requirement for working within the 6 feet before we leave?
Right. Yeah. Sure. So we know that even with the medium risk exposures and maybe even in the office, right, we know that we have to have our temp screening, our temperatures, cloth face mask 100% of the time. If we do have to get within that 6-foot bubble, additional PPE is required. That is a face shield and possibly latex gloves. That's per our policy, right? And that's for a short duration. I understand that, those physical barriers, the PPE, the addition of the face shield, right? That, and we've got the task we need to do. We've got to be within 6 foot of another. We've got the additional PPE, which is required to breach that bubble. I understand we are limiting the exposure of us having respiratory droplets, transmitted to each and one another. However, that doesn't limit our stop the clock as far as the 15 minutes accumulation. You can still be named as a tier 1 or tier 2 if for some reason your partner you were working with, had a COVID exposure at that point. We would just run through the contact tracing at that point, but we are doing what is recommended per the 3990 and adding additional personal protective equipment in the form of a face shield and latex gloves for that 6-foot close contact bubble work. I hope that cleared it up. And then lower exposure, everything else is the same. We've got the administrative controls, we've got the engineering controls we've all talked about. PPE still required, right? We got to have a cloth face cover, even though it's a lower risk class. We're still in an area of community transmission. So the lower risk class really is only going to apply to if you're working by yourself, right? So.
Thanks, Chad. The only thing that I will add on there is just when you're filling your PTP addendum out, especially those in your field, and you've identified, let's say it's the setting of equipment. So you're going to have to breach that 6-foot distancing. That has to be identified on your PTP addendum and your PTP that you're working on, what those steps are that you've added, and the protections that you're putting in place so that when we know what that is. And then also I would identify who those close contact people were during that work being performed, so that when we have to go back and do contact tracing and we need to look at that PTP addendum possibility, maybe you forgot who you worked with that day, we have that available to us to review and make sure we have that information. So that would be my only addition on there. Thanks, Chad. And we'll go into Jolene now. Thanks. And I apologize, we are running a little over, so this is being recorded, but hang with us, we're getting close.
We're really close. Good morning, everybody. So with COVID, you know, we've had some scenarios where we have had to get into the very high and high risk categories. Luckily, it has been very far and few between. We've been able to implement a lot of measures that have already been discussed by Amanda, Steve, and Chad. So thank you guys. But if we do get into some of these scenarios, as Chad touched on briefly, these facilities or environments are going to be those that are at very, very high potential, where they may have either active COVID-19 presence, or there's a high risk for us to bring it into that facility as well. So very high, these are the employees involved here, as Chad mentioned already, that those are your healthcare workers. These are the people on the front line. They're going into the hospitals, they're going into those environments where, you know, there are patients either with COVID-19 or highly probable cases. So those individuals, there's obviously a high level of risk. Healthcare laboratory personnel collecting specimens, or with those cases as well, morgue workers that are having to deal with the bodies of those with COVID or suspected COVID cases, or people, excuse me. But where we come into play is if we have to perform work in those areas. And so luckily we've been able to mitigate, as I mentioned, and not go there, but as much as expected. So there are measures, which I'll get into if we do end up going into those environments. I'll jump down to here with a high exposure risk. If we needed to provide emergency services in a hospital or high risk facility. So that's where we come into play. Obviously, we're not going to be going into a patient's room, right? We're not going to be at that level of exposure, but it's just if we go into these facilities, there's measures that we need to take to protect our people, number one, and also make sure that we're not bringing something into the facility as well. So there's a few measures that we have to take. Amanda, if you want to flip to the next slide. Whoops. Sorry, wasn't quite ready to share my screen just yet. So engineering controls, you know, we're going to be looking at physical barriers, plastic sneeze guards where feasible, a lot of administrative controls where we're going to implement, you know, barriers in place, the red danger tape, signage, making sure that we're closely working with the facilities so they understand our protocols as well and can help make sure that we keep others out of our environment and where we're working. We're going to have a higher level of PPE. We're going to have temperature screening sessions as well going in to those areas. Ideally too, we're going to look at, you know, does this work have to take place at this moment? We really need to evaluate that. I mean, if it's not an emergency type situation, can we pause and wait until COVID-19 concerns are not as much of a risk at that point? So we're going to try and work with the facility and navigate through those scenarios one by one. As far as safe work practices, PPE, it is our last line of defense here. So we are going to be increasing our level of PPE with our personnel. So the gloves, like Steve had mentioned, the latex or nitrile gloves, the face shield, in addition to, we're going to have a respirator, and that could be an N95. It could also be a half face respirator. So again, it's going to be case by case that we're going to be going through that, evaluating each scenario and choosing the appropriate level of PPE for our employees. So with that, Amanda, if you want to let me, now I'll share my screen, see if I can get this to work. And hopefully everybody can see my screen. Let me see if I can increase this a little bit more. Okay, Amanda's give me a thumbs up. So this was a project here that we did at the Tillamook Hospital. So this crew did have to go in. One of the criteria for a high risk or a very high risk scenario is that a work permit has to be completed prior to us going in. And again, it's part of the process is challenging the facility, seeing if we really need to do the work at that time. But we're trying to, much like we would do with energized electrical work, as we talked about before when we went through this training, it is a very high level, high risk task. So we want to make sure we identify what we're doing and make sure that we do our assessment and identify all those hazards up front before we just jump in and go to do the work. So, you know, there's a level of just general information at the top. I'm not going to go line by line here, but we want to know what the work is going to be, what we have to do. At that point, we're also going to identify our level of PPE. So here you can see we have an N95 respirator, face shield, gloves, nitrile gloves over cutlass, the Tyvek suit, booties. And then we're also going to have a PTP addendum completed up ahead of time so we can also identify our control measures for COVID-19. So going through that process of what Chad just went through, we're going to identify that along with this permit. The step-by-step procedures, we want to see a method of procedure along with this permit. So how are we going to enter the facility? You know, what is our means measures to make sure that, number one, we're protected again from the facility, as well as making sure we protect the facility people as in addition to that. So really clearly identifying it. There is another method of procedure. And I cannot, here's the pre-task plan that was completed ahead of time. Trying to see my screen here. They had done a pre-task plan addendum. And then let me see if I can, it's underneath my toolbar at the top, but they did do a method of procedure for this particular scenario as well. So we want to make sure everything is done up front. Everybody has a chance or an opportunity to review, you know, how we're going to do the work. In regards to the level of PPE, Amanda, if you want to go back, I'll stop sharing. If you want to pull up the slideshow again, when we identify that higher level of PPE, there's going to be some extra criteria involved. Steve touched on this with respirators, even though, you know, an N95, traditionally we've referred to them as dust masks, but when we deem it necessary for a task for employees to wear those, they do need to go through a medical evaluation. They need to have specific training. They also need to be fitted for that. So we are now utilizing an on-site medical service to where they can come out to the office, they can come out to the job site and provide that service for us for dust masks and half face or full face respirators. So when you're identified where we need to have that for that particular task, the expectation would be fill out one of the respirator request forms that you see in front of you now. So again, identifying the scope, identifying is this an emergency or not, the details of the job, and then what we're going to have our employees wear. So we can request this from the tool department, and then we can go through and schedule that fitting for the respirator at that time. So a really important piece too that I want to mention with PPE, Steve touched on it, but when we are looking at these high risk tasks, we're going to also do some training on how to put the gear on and how to remove it and dispose of it. It's really, really important, because if there's any gaps, any exposures where somebody's not wearing it properly, there's a potential risk there for them to then be contaminated or contaminate others. So that is also going to be a huge element with this whole process and training for the employees involved with the tasks. So I'm not sure if there was one other after that, Amanda, or if that was it.
So the last couple slides here just touched on traveling. I've been getting pinged a lot for what are the traveling expectations for EC, what restrictions do we have in place? We don't currently have any mandate restrictions in place. There are some recommendations between our state and Washington. Obviously, those don't apply to essential work that's being done or essential workers that are working in those areas. But just, we do have some recommendations if we're doing personal travel. You know, we do ask that you wear your face covering while you're gone to reduce the risk of exposure. All of our positive cases have been from, you know, time off or offsite exposures. So the more that we can do to, reduce that, that reduces our tier 1s, that reduces our tier 2s exposures. So your personal time is important too. I know it is your personal time, but you know, if you can wear your mask, keep your social distancing, wash your hands frequently, try not to touch your face after, you know, all of those things, maintaining your 6-foot distancing, staying in accommodations, you know, make sure that those accommodations are taking appropriate sanitation measures, monitor yourself for symptoms. And if something comes up, you know, stay home rather than come back into the office. So we do ask that you do that. If you're going to be doing business travel, there's some other steps here. And again, this document will be shared with you all later today so that you can review that. But I did have some questions about travel, so I wanted to make sure that that was covered, and it is in our policy too. Also, we do have some subcontractor travel, especially for subcontractors that coming from other areas. We do ask them to self-quarantine for 72 hours. So that is an expectation and something you need to plan for when you have people that are traveling from other states into our areas. That we do have that expectation. There is this document that you can give to the subcontractor, as well as completing the subcontractor health screening if you're going to bring subcontractors in from other states. More information. So that's the end of our slideshow. I did want to stop the share here for a second, see if we have any questions. Okay, Andrew wants to make some comments, so I'll make sure we have some time for that here at the end. I do have a question and answer little thing here from the CDC that I'm going to send out as documentation with just some of the questions that were asked to the Oregon OSHA and the health department just about contact and information like that. So I'll send that out with some of the other documentation because it may answer some questions that you may have. And then it'll be in kind of a hard document for you to read through too. But is there any, does traveling between Oregon and Washington need 72 hours? No, traveling between Oregon and Washington, as far as the subcontractor, no, we're not putting that in place. We're talking about contractors coming from like the East Coast or other states that are not in our indigenous states that are all together here. Yeah. Any other questions? I know we've kept you longer than you wanted to. It looks like Andrew wanted to say a few things, so we can open it up to Andrew.
Good morning, everyone. First of all, I'd just like to say thanks to the EHS team. Clearly, you all have been living and breathing, literally, this whole COVID situation for a long time, since back in February and March. As I was listening to this, I can only imagine that most people are feeling the same way I am, which is to say, sick and tired of having to deal with COVID-19. So, if you're like I was, sitting like this and listening to all these things that we're all having to do, I understand. The other thing that I think it's important to recognize is that we have very successfully dealt with this risk, right? So I was calculating, if you think about the field crew that we have, and I'll just use round numbers, but let's say it's about 750 to 800 people a week, times 40 hours is 30,000 hours of exposure a week. And if you multiply that by the 38 weeks of COVID, that's 1.1 million hours of exposure to the field. If you think about the 300 people in the office times 40, that's 12,000 hours a week, times 38 weeks is 456,000 hours of exposure, which all adds up to a grand total, give or take, of 1,596,000 hours of exposure. Now think about that number. And think about the responsibility that the EHS and the COVID CMT team has taken on. And at the end of the day, it is not possible for a team of 20 people to manage all of that time. Not possible. And what that just points out is that we each have to take responsibility for protecting ourselves and for protecting those around us. The masks are intended not just to protect you, but to protect those around you. So we all have a responsibility to protect the people around us. And so, yeah, I hate wearing masks like everybody else. I can certainly work part of the time in the office and part of the time at home. But when I'm in the office and when I'm at home, it's my responsibility to try to keep myself healthy. And I hope that each of you will see it that way, as opposed to what a total pain in the ass having to do all this is, right? I mean, I get it. I understand that feeling that it would be better if we didn't have to deal with this. Yep, it would. Unfortunately, that's not what the reality is. And so, when confronted with a challenge, when confronted with a risk, I think we all have to step up and accept that risk and accept our responsibility to mitigate that risk. And each of you, and the other part about this is that people think, well, I'm not going to get infected, or I'm not going to pass it on. Well, fact of the matter is, you all are potential spreaders of this disease. And the other reality of that is that if and when people get it, and you don't even know, it's not even necessarily people that are just vulnerable because of health conditions that will get really sick. It's not clear to anybody who gets sick, how long, whether it lasts, whether it doesn't, whether you have any symptoms, whether you don't. And so there's so much unknown about this. The only real way we have available to us to prevent this is to do all the things that we've just laid out, the EHS group has just laid out for you. So it becomes a personal responsibility to address the risk and to protect yourself and to protect everybody around you, right? I've used being a master of your own safety as a commentary, and I think this is a perfect example of the need to do that you are the master of your own safety and you have a responsibility to keep yourself safe and those around you safe. So thank you to EHS for putting all this information together, and to the folks that are on the CMT group, also for continuing to monitor the ever-changing set of regulations and rules. And I think especially to the folks on the EHS team, Amanda in particular, who has, I will say, had to wrestle with this in a very direct, personal, daily way to try to keep all of us safe. The fact that we've had 1.6 million hours of exposure and we have only had 12, I guess, cases, maybe it's gone up in the last week that I haven't heard of yet. So, you know, the reality is that we have all those hours and the exposures have come from outside of work, not from work. And that's remarkable if you think about that. So 1.6 million hours of exposure and no cases that have been generated directly from that experience, or maybe one, but that's one of those question marks at the moment. But in any event, thank you to the EHS group and to the CMT for their effort. Thank you to all of you for continuing to maintain your vigilance and taking these precautionary measures so that we don't end up in a situation like we almost did about a month and a half or so ago, where we had in 2 days 100 people potentially exposed to this. Now imagine if even half of those people had picked up the virus and then exposed another 300 people or 500 people, and we're going to be not working. We're going to be shutting the business down. So that's the ultimate risk here. It's not just individually, ultimately it ends up being a risk to the whole company. We risk, you know, early on in this thing, when you look at the numbers, even if you take 1 or 2% or 3% infection rate, I think New York City is up at 4.5 to 5%. You know, take that 1,000 people at 5% is 50 at an infection rate. And if you take those 50 and then at, you know, call it 2%, several people would be dead now if we weren't doing this. I mean, that's just the bottom line, is that if we weren't taking these measures, we would have way more infections. We would be unable to be operating our business the way we have continued to be able to do. And there would be some people that we all know and we all care about that would no longer be with us. That's the risk. And in the field, people recognize electricity as an invisible risk, managing it all the time, every day, every hour, every minute, every job. And this is the same thing, except that it's more broadly a risk to everybody in the company. So please take it seriously. The consequences literally can be fatal to either those or those around us. And I hope that we will, you know, get some good news on the vaccination front. Immunizations are pending, but it's still 6 to 9 months away before that's really going to be anything that's going to have a major impact on reducing the infection rate. So this isn't going away for 6 to 9 months. I hate to say that, but don't let your guard down because Pfizer and Moderna are going to be shipping immunizations to frontline health workers and sick folks over the course of the next 6 months. That'll be great, be a good thing, but it's not going to immediately eliminate the risk. Thank you very much. I appreciate EHS. Amanda, you can take the close. I am now about to join the crisis management team meeting and have a conversation about this for another hour. Woohoo! Take care, everybody. I hope you stay well. I don't know, Amanda, you got the close.
Yes. Thank you, everybody. As Andrew said, let's just stay diligent on this. Everything that we're doing is working, and if we can keep that up, remind each other, you know, if their mask isn't on properly, remind each other to put those on properly with a gentle reminder. But the expectation is that we're following this policy and everybody is participating in reducing the spread of COVID. And thank you so much for your time and for staying with us past time. And I will be sending out the documentation later on today. So if you have any questions, you can email the EHS email and we'll be happy to answer those too.
Thank you, everybody.
Thanks, everybody.
Take care.
You too.
Thanks.
Mass exodus.
Thank you.
Can you save the chat, Jolene?
Yes.
Was it?
And I got to bounce to the other meeting too.
So I think when you send out the information, it probably would be good. We had people joining. I think some people got kicked off and tried to join again, but I mean, I had people past 9 o'clock joining in.
Really?
Yeah. I was keeping track.
So when you get the recording,
It's
I can have it uploaded. I think MIS has to make it a YouTube document and then it can be uploaded onto the website and in key style. So I'll put that documentation on there.
okay. I'm going to stop recording.